landmark clinical trial will get underway soon here in Cook County to test an antibody treatment for COVID-19. Joining us now is Dr. Gregory Hune. He is an infectious disease physician for Cook County Health and the principal site investigator of this study. Any new study, anywhere we can make progress is exciting, Dr. Hune. So I know we need to give people a little bit of a science lesson here. When you have COVID-19, your body develops the antibodies. Some people give blood, and that plasma and the antibodies in it can help. But this is translating those antibodies into a medication. Talk about how that works.
Yeah, well, thanks for having me on this afternoon. So our bodies generate a wide array of antibodies in response to infections. And so this particular antibody was, let's say, harvested from a survivor of COVID early on in the United States epidemic. And this is a specialized antibody that really responds to the proteins on the surface of the virus and to disarm those proteins so they cannot attach to the cells in the body. So the goal here is in high numbers, and these are grown in the lab, that when you infuse this antibody formulation, that it overwhelms and disarms the virus's ability to invade human cells. And so hopefully if we capture patients early on in their infection, that it can prevent complications down the line. And together, importantly, together, by limiting the damage in the body and by hopefully clearing the virus, then we prevent those transmissions to other close contacts.
So clearly this sounds like a better option than some of the medications that we've tried before, which seem to attack the symptoms but not the root of the virus itself.
So this is an addition to our arsenal. So we have an antiviral remdesivir. We have steroids now that seem to modulate or affect the immune response. And in one study actually showed that there were lower death rates in those hospitalized patients. And this is actually looking at the early type of symptomatic patient that if we get this type of therapy on board early, the NIH finds this as a very promising, effective type of therapy, not only just for treatment, but also for prevention to, again, in those that may not be infected, those that may be in close contact to people. And there are going to be other studies down the line before vaccines are available to see if we can prevent infection by providing that overwhelming antibody response through a one-time infusion.
Boy, in the absence of a vaccine, prevention would be absolutely amazing. You mentioned people in the early stages of disease. Are there other parameters for people who might be eligible to get this drug in the study?
So this study is called the BLAZE-1 study. The eligibility is 72 hours from diagnosis to the first dose. And those are in patients that are outpatients, so not hospitalized, those patients that do not require oxygen and have early symptoms of infection. So that's the main goal, is to capture those early infections to try to prevent those complications.
And how is the drug administered?
It's a one-time infusion. And the way the study's designed, this is gold standard. So in order to have the most useful information to know if this is going to be effective, patients are enrolled, and it's a coin flip whether they receive the infusion or whether they receive an infusion without the antibody. And so that way we'll be able to determine if the antibody itself is going to be effective in preventing those types of complications.
All right, well, check back with us when you begin to have some results. It sounds very promising. Dr. Hune with Cook County Health, thank you.
Okay, thank you.
The number of